Okay, today we're going to talk about chapter 4, and then it's a really short chapter. It's only 18 slides. So then we're going to talk about online counseling. And this is something that you're going to have to do is the online counseling, since we're not anywhere close to each other. I'm 1,500 miles north. I don't know where anybody else is. Well, you guys are mostly on the res. Yeah, we're going to talk about doing online counseling. Why don't we go ahead and get started with chapter 4? Chapter 4 is about professionalism and professional relationships. If I can make it start. There we go. A professional is a person who has specialized training for a particular career and who acts in conscientious, appropriate ways in the workplace. Being a professional involves conducting yourself in an appropriate manner, dressing appropriately, being organized, timely, and accurately recording meetings with colleagues and clients, and being prepared for meetings. Acting responsibly at all times, behaving as a mature adult, using language that is culturally appropriate, age appropriate, understandable, and not offensive. Speaking honestly and with integrity, knowing how to communicate information. Each setting has different expectations. Roles vary based on different ages and backgrounds of your clients, system size, individuals, groups, families, and organizations, levels of training or education. Practitioners with graduate degrees might have several roles, working independently in private practice, being a counselor or educator, being a supervisor, being a consultant, and being a director. One task that practitioners with graduate degrees may be asked to do is act as a mediator. A mediator provides an impartial forum for disputing parties to discuss areas of disagreement or misunderstanding. Generalists maintain expertise in a broad range of functions: case management, where they coordinate and monitor services, as a broker, linking clients with services and resources, and as an advocate, working to support a client. Being professional goes beyond what you do in your interactions with colleagues and clients, being aware of the social, political, economic, and cultural factors that impact individuals, families, groups, and institutions, and advocating for their betterment. Developing a professional identity involves knowing what it means to be a practitioner of your particular discipline. Scope of practice involves knowing what activities, knowledge, and skills identified by licensing boards and professional organizations relate to your discipline. Sometimes organizations will employ groups of professionals that they will organize into working teams. Each member will bring their own professionalism, culture, education, and individual ways of dealing with clients. Working productively with interdisciplinary teams is an important aspect of being a professional. This may mean that the practitioner must learn the language of another profession. Every professional must respect the expertise of their professional colleagues. The practitioner working in a team must recognize that different professionals may work toward the same goal using different methods. Even in the same profession, practitioners may use different approaches. Your supervisor will help evaluate your level of competency by providing feedback about your use of skills, inviting you to engage in self-reflection. Consultation involves meeting with an expert who can help you solve a particular dilemma or problem. Sometimes your client's problem may be beyond you or your team's ability to handle. At that point, a consultant must be called in to help. Most professions set ethical guidelines for remaining current with best practices, continuing education, evaluating your work, continuing education, and ethical standards every year. While the practitioner is responsible for structuring the relationship with the client, success can only be reached if the relationship is collaborative, goal-directed, purposeful, and time-limited. A relationship between a client and practitioner is a fiduciary relationship. The client has confidence and trust, that's what fiduciary means, in the practitioner's competency. Unequal with practitioner, unequal with practitioner having more power than the client, but with the power comes a responsibility to help the client in the manner prescribed initially by the practitioner. And I don't know why I put that picture in there. I'm not sure which one's stronger. She seems to be getting away, so I'm thinking she's stronger. And that is the end of chapter 4. However, we're going to tackle counseling online. As I've been telling you, or as I should have been telling you anyway, we have to counsel online because we aren't face to face, and therefore we need to figure out a way for you to practice counseling to find out if this is the direction you want to take. So I'm going to talk about counseling online. Let me give you a little history of what counseling online has meant to Dene College. About 3 years ago, we hired a man to teach at Tuba City, and he was supposed to teach a whole raft of classes, and one of them was counseling. He was going to teach this class, the 291 class. The Friday before classes started on Monday, he quit. So, and what he thought was going to happen was it would be a total collapse. He was trying to punish the department chair. He didn't like the department chair, and so he was going to punish her by creating chaos. But what happened was, at that time we had three instructors, and then he quit. That left 2 instructors. What happened was that other the other psychologist, other than myself, the other teaching psychologist, she took one of the classes, and I took all the rest of the classes. Now I was already teaching counseling online, or I was teaching counseling, and so what we needed to do, we needed to adjust all those classes to become online classes. What he hadn't done at all. So between the Friday when he quit and the Monday when we started, I had to put together 4 different classes. One of them being an online class for introduction to counseling. We did it the first year, and that's when I came up with this PowerPoint, trying to convince them that this was a viable option, that it has been done in places around the world, and it can work. And I do have some statistics that will show that it works wherever they use it. And now, of course, that COVID has hit, this may be the wave of the future. So online counseling is something that needs that will be happening, is happening now, and will be happening in the future. To some extent. Maybe after COVID is eradicated, if that ever happens, then we won't have nearly as much online counseling. But right now, this is really, really important. And so we do have a history of teaching this class online. Since 3 years ago, we have taught it every year as an online class. So that is, and now we don't teach it in the classroom, as weird as that is. So one of the things I'm going to have you do is create characters, and we did this in the classroom. You need to create a character that your cohorts, the other students in your class, can counsel. The character that you're going to create has to have a problem, has to have a mental health problem. It can be severe, it can be minor. It really doesn't matter. But one of the things that you have to ask yourself is, I can't have a counseling problem. I can't have a character that has a problem that I've ever had. And you also need to stay away from a problem that is close to you. Maybe you don't have this problem, but maybe your dad's got it, or mom's got it, or you know your cousin brother has it or whatever. If you're close to this problem, then don't pick it. Pick another problem. There's lots of problems out there. The the DSM-5 is it's over 700 pages long. I'm sure you can find something that nobody around you has. So that is your task, is to come up with a character. I'm going to put a form online for you to fill out. It's a character history. And the other thing that you need to do is you need to come up with a fictional name for this individual. I don't want them calling this individual by your name, or you may adapt their actual problems if you're thinking of that problem as you having it. So you need to come up with a fictional name. Okay, so we're going to start with we're going to talk about this chapter, and as you will see, the online counseling is quite viable. Counseling online. Okay, there we go. Psychologists commonly refer to any therapy delivered by telecommunication tools or devices as telepsychology. You may hear it called web therapy, phone therapy, text therapy, or online therapy. Anytime you're interacting with a psychologist using a website, a phone, or a mobile app, you could be taking part in telepsychology services. I had a colleague who discovered that she had a problem she needed to deal with. She was on the reservation, so she started doing telepsychology. And when she's no longer at the institution, but when she left, she was still doing it 18 months later. So evidently, it worked well enough for her not to dump it. So I guess that's something positive. Technology can contribute to an evolution in how people receive psychotherapy or work with a psychologist. Researchers are taking great interest in telepsychology and telehealth, evaluating how well it works, especially compared to in-person, in-office psychotherapy sessions. Now, one of the things you're going to discover if you start thinking about, maybe I'd rather be a social worker or should I be a psychologist? Social workers usually do their counseling. Sometimes they do their counseling in their offices, but usually it's at the client's home. Psychologists never go to a client's home. So if that is what you want to do, then potentially you need to go into social work. They go to their clients' homes to help them. But much like the technology, the research is still new, and there is a lot science doesn't yet know. There are a few points to consider before signing up for any services that are offered exclusively online or by telephone. It can be convenient. Online therapy can take less time away from the office or your workday or worry about traffic. No need to travel miles to meet up with your psychologist. Dial a number or log in to a site, and the session can happen wherever you are comfortable. Compared to the traditional in-person therapy, it can sometimes appear less expensive. Some apps will advertise pricing that provides unlimited use for a weekly or monthly fee. The online session may seem significantly lower than in-office visits. If you're not interested in using health insurance for psychotherapy, this can be a benefit. Online communication is very comfortable for many people, especially younger adults or those who use technology often. More people are using email, webinars, and text messaging to communicate, and it can seem more comfortable or easier than talking to someone in person, especially when revealing personal or private information. It can provide access to those who can't get to an office. In some rural communities, the nearest psychologist office may be an hour or two drive away. Some people with chronic illnesses or disabilities may not be able to drive or be easily able to leave their home. In these situations, web or telephone-based therapy may be their only option for help. The research hasn't yet shown that standalone therapy online or via texting is effective for everyone in every situation. Some sites advertise that they offer therapy, but those claims may be misleading or false. For example, the people behind the apps may not be licensed or qualified to provide therapy. Licenses are granted by each state with their own laws and rules, much like each state determines what residents must know to earn a driver's license. But unlike driver's licenses, which allow you to legally operate a car in all states, a healthcare provider is limited to providing services in the state in which they are licensed. The provider must be licensed in the jurisdiction where they are located, and making that determination may be difficult to do if you don't know where he or she is physically located. Psychotherapy works in part because psychologists ensure that clients have a safe, private space to share deeply personal and sometimes difficult stories, thoughts, or emotions. What happens and is said in a therapy office stays there with the exception of a few situations. The site or app you use should be, at minimum, be HIPAA compliant and have the ability to verify your identity and your therapist's identity. HIPAA, of course, has to do with the hospital, the strictures on hospitals, so it must be HIPAA compliant. Many insurance companies cover the treatment of mental health and substance abuse disorders, but online therapy or web therapy services are often not covered or reimbursable by most insurance providers. A total of 62 participants suffering from depression were randomly assigned to a therapist. This is, we're talking about research that they've done looking at internet-based face-to-face cognitive behavioral interventions for depression. Okay, so they're looking at 62, and I think there's 62 people in this picture, and that's why I put this in here. Not that all these gymnasts are depressed. A total of 62 participants suffering from depression were randomly assigned to the therapist-supported internet-based intervention group. The number was 32, and to the face-to-face intervention, and the number was 30. 8-week interventions were based on cognitive behavioral therapy principles. The intention to treat analysis yielded no significant between-group difference, online versus face-to-face group, for any of the pre- to post-treatment measurements. At post-treatment, both treatment conditions revealed significant symptom changes compared to before the intervention. Okay, I don't have the website. Okay, I don't have the reference. I'm sorry. The intention to treat, oh no, I've already done that. A total of 113 consecutive patients were randomly assigned to 10 weeks of either, this is another one, this is internet versus group-administered cognitive behavior therapy for panic disorder. A total of 113 consecutive patients were randomly assigned to 10 weeks of either guided internet-delivered CBT, 53 people, or group CBT, 60 people. After treatment and at a 6-month follow-up, patients were again assessed by the psychiatrist blind to treatment condition. They found no statistically significant differences between the two treatment conditions using a mixed models approach to account for missing data. Group CBT utilized considerably more therapist time than did internet CBT, cognitive behavioral therapy. 2 new studies suggest online therapy may be effective for treating mental health issues. Online therapy is increasingly popular, particularly among people who live in rural areas and cannot easily get to a therapist's office or who are concerned about the costs of in-person therapy. New technology may pose some concerns, and the security of online therapy continues to be an issue, but research suggests the benefits may be significant. The first study, published in the Canadian Medical Association Journal, reviewed studies of online cognitive behavioral therapy conducted between 2000 and 2012. CBT is a widely used and well-researched form of therapy, with most studies saying in-person forms of this treatment are highly effective. CBT focuses on reducing negative thoughts, thereby changing behavior and alleviating symptoms. Most of the studies tracked participants for a relatively short period of time after ongoing therapy, ranging from 8 weeks to about 2 years. Researchers found online CBT could effectively reduce symptoms of depression and other mental health issues. In some cases, online CBT was even more effective than traditional in-person therapy. Most online CBT sessions focused on short-term goals and symptom relief. Because of the studies did not track participants for an extended period of time, the researchers do not know if the symptoms were permanently alleviated. The team that conducted the analysis cautions that some human connection is lost with online therapy, but they also say that the evidence supporting online therapy's effectiveness is significant. Another study published in the Journal of American Medical Association Psychiatry looked at how online therapy affects the well-being of new doctors. Young doctors often work long hours, including nights and weekends, and the stress of these long shifts can lead to mental health issues such as depression and suicidal thoughts. One previous study found that suicidal thoughts increased fourfold during a medical residency. Researchers looked at 200 first-year medical residents working 80-hour weeks and overnight shifts. Compared to doctors who received no online therapy, doctors who received 4 30-minute online sessions before beginning their residency had fewer suicidal thoughts. Because the sessions were delivered online, researchers say it might be possible to provide such treatment to other doctors while still keeping costs low. And that is the end. So as you can see, all the research says that it's either the same. Some actually say it may be a little bit better than face-to-face counseling. Lots of different places, lots of different looks at online therapy. All of them were relatively positive. So there you go. Please don't think of online therapy as something that just happens with, something that just happens with because of COVID. It may be the wave of the future. We may not have face-to-face therapy in the future. You may be able to go to a work site or call somebody on their phone and have a counseling session while they're working or whatever. I guess that's unethical, isn't it? Well, for them it's unethical. It's not unethical for you to do it. Anyway, just killed a fly. There we go. Okay, so that's the end of what we're going to talk about this week. I'll see you next week.